Hello guys, welcome to our channel. Today we'll be discussing how the June 2026 results has been changed from the Jan 2026 because we can see the drastic decrease in the pass percentage and the failure was really highest in the FMG history, and we'll introspect into ourselves and also knew the NBME patterns what has changed. Okay, so let's start the discussion guys. And recent FMG statistics has shown that total 37,000 students has been participated in the examination, and out of that only 4,600 students has passed. And this is around 12.38 percentage. But the field students has been more concerned that the 31,645 students has failed this examination, because this is something that is really concerning, because we have seen the FMG history is and around the passing percentage was increasing in the last 2 to 3 years. It was in the 20%, 25%. The last Jan exam only it is around 25%. But this time it is has dropped from almost 12.38%. And this is something really concerning to the students' life and upcoming FMG aspirants also, because it will create some different type of the fear to attempt itself and to prepare itself. So we will understand what and where went wrong. The first thing is that the previous FMG pass percentage 25%, 20% and something, but this is really low. And possible factors, as I have thought about it, is the new pattern. The last examination is something different, because we seen the pattern of the clinical based questions was increased, right? All the clinical based questions is increased drastically, around the 50 plus conceptual questions only, and greater subject integrations, especially medicine, pharmacology, physiology, and surgery, anatomy. All this has been asked in the different manner of more subject integration, and depth of the knowledge is tested. More importantly, this is also introduced in the recent examination. Next pattern is that new pattern, which no one has expected. This came up as a surprise in the examination hall itself, that the video based questions, right? The video based questions has no one expected. And dynamic clinical scenarios, something are newly has to be introduced into our mind to understand itself and to answer the questions. And image interpretations, video based interpretations, management based questions, and multidisciplinary MCQs, all this has been increased in the with the new surprise in this FMG examination, right? Video based questions are really something tougher that the most of the students is expected, because that is something new pattern that we don't even see in even in the USMLE pattern also. And 300 questions, video questions, which has consumed an additional time, and longer clinical stems has been reduced the effective time per questions to the every students, because we see that the 300 questions we will be having the two sets, right? 150 questions in the morning and the 150 questions in the evening. And when you kept that at least 1 minute per questions, so 180 minutes, so 150 questions. So the students who are spending around this video questions, that is around the 30 to 40 seconds. And even if you spend at least 2 minutes per questions, that has been drastically decreasing to the other questions, right? What if it is a clinical based questions? What if it is a other type of the questions? So mostly the students' time management has affected with the new pattern of the questions. At least if they have informed us the priorly, and we have prepared our minds and we have prepared ourselves, then it would be easy. But they came up with the surprise and they have made this drastically change in the FMG pattern, right? That has been affected the students. And over the time, the students' preparation factors from the different platforms, different coaching centers, what have thought is the PYQs. PYQs is the model code. PYQs are the one of the important. And pivot is also most of the students have followed, but that pattern has been changed by NBME, because memorization over the concepts is not working nowadays like the last time. And limited exposure to the video based learning for ourselves, because most of the times we will be learning from the theory and only the pattern of the previous questions only. And inadequate preparation and the pattern of the specific mock tests that we have attempted from the different platforms also, and limited integrated MCQ practice, right? All these might stuff factors that have played from our sides, because the new pattern that has been not well adapted, because we have also surprised from different pattern that we have practiced, right? And why did the pass percentage fall? because that is the first question that we have to ask ourselves because of the new format by the NBME, clinical emphasis, and the time management and adaptation challenges. But this is the last thing that we are facing. No, there is a many other things also we are facing from the previous also. When the image-based questions was first introduced, it is also a new pattern, but over the time we adapted. And this challenge also we are going to adapt. We are going to adapt this new format. We are going to adapt the clinical emphasis and integration, and we will overcome the time management issues and the adaptation challenges. Right? This we are going to improve ourselves. And what we need to follow, again, the clinical reasoning is more important, and concept building is more important, image and the video interpretations. And if you can observe, videos are 20 video questions are asked and images on and around 30. And if this is the important, the 50 questions plus that is going to play the role. So video learning and the image based learning is important for us, and integrated revisions. I always emphasized in my students classes that especially the physiology, pharmacology, pathology, and the medicine, these are the cornerstone and you have to integrate them. And not only these subjects, many other subjects also, you have to focus on the integration. Even if there is a scenario, if you are facing the challenge, you have to overcome, then only you will start the integration. And the grant test, more and more grant tests that has to be given, because time management has to be important for us, right? So make sure that you will be attempting this grant test and the conceptual learning and integration, so that we will be overcoming this challenge also. And I wanted to stand with all the students, solidarity of the 31 students who have failed, and I will be standing with you and I will be supporting you. Please, your focus and the preparation should be understanding the concepts and the practice the clinical based questions and adapt the newer styles and revise repeatedly. Don't give up. And if they have challenged us, we are going to challenge with us preparation. With our preparation, is going to prove them wrong. Whatever the tougher level you give, and we will face it and we will overcome it, right? And my final message to all the students, I will stand with you with the solidarity, and I will make sure that your new conceptual learning will be more effective, more clinical based learning, and more enthusiastic learning. Okay, don't give up. The time is not less. You still have the time. For the January examination, start from today. Build your concepts, build your clinical situations, build your effective learning from today itself. Whatever the challenge, even if the MBME is going to change the next pattern, we will face that and we will overcome that. Okay, and don't run behind the courses and don't run behind the coaching centers, because sometimes they also stick to the previous pattern only, right? So I wanted to tell you that you introspect yourself, you know yourself, what is helping you, what is understanding you better. Then you can answer, right? You have to apply your knowledge. Then, if that platform is helping you, then only you go. Just don't go with your friends' advice, or don't go with your and their advice also. Just understand your own knowledge, whether that is going to help you, whether that is going to make sure that you are going to clear this, then that only you have to follow. Okay, so don't give up, guys. Just spend the time with your loved ones and take a break and come back again and start your preparation immediately. And yes, I am telling you that this is not a setback, but this is a lesson for us, and we are going to clear the examination with the good scores. And I am expecting you all. Please stand behind the yourselves and give the supportive to you, and moral support take from your parents. Okay, and stand strongly and don't give up and come back soon with your good scores. Okay, and we will be acknowledging the NBME transparency, because they have not been transparent and their behavior is insignificant to the today's world, how the FMGs are facing and their pattern and their behavior as speaking by themselves. Okay, and we will also stand with the fighting for the NBME until the end. Okay, so don't give up, guys, and please make sure that you are going to come back strongly. And all the best in advance, and we will come back with the FMG pass in the next January 2027 examination. Thank you, everyone, and see you in the next video.